Diabetes is a disease that affects a large number of people in Fresno County. One local outreach minister has made it his mission to educate people in the community about diabetes because in 2019 he was diagnosed with it and knows the complications all too well.
Good morning. Hi, Mr. Thompson. Come on in.
At the Community Diabetes Education Center, patients like Legger Thompson meet with a registered dietitian and diabetes educator to learn how to take control of their diabetes diagnosis. Legger is a charter bus driver. 2 years ago, his poor dietary habits caught up with him.
How I really think I got it is because I never ate on time. I would just go like hours of driving. Sometimes I would go like 6 hours with nothing, just maybe some water so I could stay focused on the road. Or then if I did eat something, it would be like some sweets, some candies. I didn't know the difference between carbohydrates and vitamins. I never could separate it, you know, what is good and what is bad.
He was shocked when he was told he had type 2 diabetes, a disease that affects many in the San Joaquin Valley.
When I came in, they was telling me that I was diagnosed with having diabetes. Like, man, I'm healthy. What do you mean I got diabetes? I feel good. I work out 5 or 6 days a week.
In fact, the counties of Fresno, Madera, Tulare, and Kings have diabetes death rates higher than the state average and among the highest in the state.
So first thing I started thinking about was amputation.
Legger and his wife Izetta are also outreach ministers and the founders of LIT Ministries, an acronym of both their first names and last. They work with people in homeless shelters and women's shelters and noticed a disturbing trend, especially in the African American and Hispanic communities.
People get diabetes and they don't get educated properly. You know, I see a lot of people in wheelchairs because they had their legs cut off. I see a lot of people, you know, with their arms cut off. And these people are on the streets and they're homeless, you know. And I think because they don't get the proper education, they don't go to their doctors like they should.
Diabetes complications can include nerve damage and poor blood circulation, and in worse cases, those untreated complications can lead to an amputation of the foot or leg. Fresno County has the third highest rate of amputations due to diabetes among California counties.
They're very high in fiber.
To manage his own diabetes, Legger began meeting with diabetes care and education specialist Rosalva Reyes.
The more they know about the disease, the more that they will take care of themselves. Once he learned that, he became very motivated and very eager to make changes, and he has. In fact, he started with me in August on medication, and by his, I believe it was November, when he had his A1C done, it improved so much that they discontinued the medication.
Rosalva taught him how to tell the difference between carbohydrates and sugars, how to put together a well-balanced meal, and about portion control. But the work didn't stop there. Legger and Izetta realized not only could they spread faith, they could teach people in the communities they reach about the dangers of diabetes.
It was such a blessing to me, and it helped me in my life that I can be a spokesperson for them. I don't care how much we preach to them and do all that. If you ain't eating right and drinking some water, you're gonna perish.
Rosalva says she couldn't be more proud of Legger and knows his word can go far in our community.
I felt that as he was learning, he was not only learning for himself, but he was also wanting to take the education to others. I'm hoping that through him, others will get the same awareness that diabetes is a manageable disease.
For more information on the diabetes programs offered at community medical centers, call 559-459-1763 or visit communitymedical.org/diabetes or talk to your doctor about a referral to community diabetes education.